Well, COVID-19 clearly is no respecter of persons, wealthy, poor, political, religious persuasion, doesn't matter. The virus doesn't care. But one segment of the American population has been particularly hard hit, and that's those residing in and working in nursing homes. And joining me now to discuss this troubling trend is Dr. Sunil Parikh at Yale University in New Haven, Connecticut. Welcome, doctor. Thank you for joining us tonight.
Thank you for having me.
Well, according to the Kaiser Family Foundation, more than half of the fatalities in 14 states have occurred in these care facilities. Why is that?
Yeah, the numbers are absolutely staggering. As you mentioned, the nursing home population accounts for less than 0.5% of the United States population, but overall, probably up to a third or more of all fatalities. And in several states, as you mentioned, these numbers are even higher, 50, 60, 70%. The reasons are multiple. As we know from the COVID-19 pandemic, the elderly are especially at risk for high mortality. We see case fatality rates of up to 20%, meaning 20% of individuals in those age groups of particularly 70, 80 years and older have a very high risk of dying. The other issue in nursing homes is that these individuals often have a lot of comorbidities, such as lung disease, heart disease, diabetes, hypertension, and these are all risk factors for severe COVID. On the whole, the nursing home population tends to be a bit sicker too, and that's often why additional care is needed. So these factors together really set this population up for higher risk. But when you look at the nursing homes themselves and you go into them, you'll see there's a lot of communal settings. You often have a single caregiver taking care of multiple individuals. These caregivers are also exposed to linens, other infectious fluids because they are bathing residents and other activities that put them at particular risk. There are a lot of factors.
Well, and you mention it and you bring up a great point. How can you be expected to be socially distant in a setting such as that, where there are very few, for example, single rooms where there's only one patient per room? There are often two. And to protect the staff and to protect those people, is it even possible to socially separate?
Yeah, it's very challenging, and this has been one of the biggest struggles that individual nursing homes have had. And I will say, there's certainly shortcomings in many nursing homes due to funding and other situations, but they're really not set up for this degree of infection control. And it's no fault of their own. This is a really difficult pandemic to deal with. The folks working in these facilities are not trained to the level of a hospital worker, say, to learn how to put personal protective equipment on and off properly. So it's a very challenging setting to manage this, to separate individuals. It's very challenging. I'd say, one of the biggest reasons for this is that we just haven't had a national coordinated focus on the nursing homes. I understand the focus on the hospitals, and it makes sense. But from my perspective, one of the pieces that is missed in this whole story is if we want to limit the surge in the hospitals, if we want to limit the use of PPE and we want to save the most lives, it makes sense to focus on settings where the disease is causing the most harm. So I really would like to see us reshift our focus on the nursing homes for that reason. There's many reasons.
And doctor, before we run out of time, we only have just a few seconds left, but can you address the other victims in this? And those are the family members who aren't able to be with their family members, who aren't able to enter these facilities to visit and to care for them themselves.
That's been one of the saddest pieces. I know we've all seen these pictures and videos of family meeting from the outside of the window, and it's really been a really sad situation. Unfortunately, I see that this visitation restriction is really going to last. I think we're going to have to think creatively how we may be able to connect families with their loved ones in a better way. because I think this is going to be a protracted situation. I think the first step is really to refocus our attention, do widespread testing of all staff and all residents so we know who's infected so we can take the proper steps to mitigate further spread.
All right.
And save
Dr. Sunil Parikh, thank you so much for joining us. And one of these days we're going to be able to sit down and talk about hamburgers at Louis' lunch once again and talk about something pleasant, right? Thank you so much. Please come back and join us again, won't you?
I'm happy to do so. Thank you for having me.
You're quite welcome.